Hey guys, so we've talked about client intake. We've done informed consent. So the next step would to be evaluate their readiness for exercise based on their health. So one of the documents that are recommended and are more commonly used is the Physical Activity Readiness Questionnaire. There are other types of health screening documentation. I like this one because it's a pretty simple and quick overview. There's only 7 questions, but in those 7 questions, you get to the bottom of whether medical clearance is going to be necessary. So this link here will take you to the eParamedics webpage. And there's actually, if you go to the PARQ online on this webpage, it will take your clients through a survey that is like the physical activity form. And so sometimes that's easier to ask one question of this survey at a time. So these are the 7 questions on the PARQ form. This file is like 4 pages long. Most people only fill out the first page. Within this page, you can get a good idea. If they've checked yes, then you need some follow-up, right? So that means that they do have symptoms of chronic disease or have some kind of other injury that we need to be careful about during exercise. So if they check yes, then they probably need to go to a physician. What the PARQ Plus has added is additional questions to decide whether these chronic diseases that are mentioned are managed or not. And so that would be if somebody answers a yes on this first page, then they would continue and go answer the follow-up questions related to that question and these questions. And then it will give them further diagnosis of whether, you know what, your symptoms are managed or, your injury was like over a year ago and you're not experiencing any pain, so this isn't really an issue, but we'll monitor it. So it's giving those kind of basically just advice and guidance. Obviously, this form is not a medical physician, so it's always best to defer to a medical physician if you have concerns. What the survey does is skip the questions that are relevant, the online survey that I was telling you about. And so if they put just one of these, like I have high blood pressure, then it will only go to the follow-up questions about high blood pressure, and I'll skip the rest about like arthritis and other things. Anyway, so this is a quick overview. You can see pretty quickly whether there's something that you need to ask some follow-up questions about. And you and your employer will probably decide the best way to use this form or a different form. So if somebody has symptoms of chronic disease, so they have high blood pressure, they're experiencing dizziness or shortness of breath, chest pain, if they have diabetes or kidney issues, if they have a recent musculoskeletal injury that is still giving them problems or pain, that's going to be a situation where you defer to a medical professional. And what ACSM has done is give you a decision tree, for helping you determine this. And so what they've started with is, does the individual exercise regularly? This decision tree was created just a few years ago because they want to reduce barriers to exercise. So they were finding their old way, which we'll talk about next, of deciding whether somebody needs exercise medical clearance, was sending way too many people to the physician. And most people, if they can't get into a doctor soon and that process gets dragged out, they lose their motivation to exercise while they're waiting. And so if the risk isn't high enough, then it might be better to start exercise and then get medical clearance necessary if something arises later. And so this is how you decide that. So again, this is based on the ACSM, the American College of Sports Medicine pre-participation guidelines. So you start with, does the individual currently exercise? And then you go yes or no. If the individual currently exercises, so yes, so we follow that here. Does she have or he have cardiovascular, metabolic, or renal disease, or signs or symptoms? So this is disease that is diagnosed or current symptoms. So if they say they don't have heart disease, but they do have shortness of breath or dizziness, that's going to fall into this category. So that would be a yes. If they have disease, this next question is asking about if they are actually asymptomatic. So they may have been diagnosed with high blood pressure, but they've been on medication for 2 years and their medication is managing their symptoms. They haven't had a high blood pressure reading since that time, then they're asymptomatic, right? So they've been exercising and so they're asymptomatic during rest and during exercise, and that's the difference there between this other side of the tree. Because they have been exercising, so they know what their heart response is going to be to exercise. If they haven't been exercising and they were asymptomatic, but we really don't know if they're going to stay asymptomatic when they start exercise. So that's why this does the individual currently exercise regularly matter so much. Okay, so if they're asymptomatic, then no, they don't need medical clearance. But you want to start with moderate exercise and gradually progress to vigorous if there's no change in symptoms. If they have disease and they're not asymptomatic, then you want to go get medical clearance. If they exercise regularly, so yes, and they do not have disease or any symptoms of disease, they don't need medical clearance. And then when we go over here to the other side of the tree, they're not exercising regularly, then do they have disease or symptoms of disease? Then if the answer is yes, then they need to get medical clearance, definitely. There's no further breakdown of whether it's asymptomatic or not. If they haven't exercised and they have disease, or there's any indication that they might have disease, they need medical clearance. That means they need to go to a doctor, and a doctor needs to say, yes, you can start exercising, or yes, you can start exercising with modification, or no, you don't need to exercise. Whatever that process looks like. Okay. If they haven't exercised regularly and they don't have symptoms of disease, then they don't need medical clearance. Right, so this decision tree is helpful, and we're going to go through a couple of examples real quick. So let's take a 50-year-old non-smoking male recently invited by colleagues to participate in a 10-kilometer trail run. He currently walks 40 minutes on Monday, Wednesday, and Friday. So he's a current exerciser, and he's been doing this for years. His goal is to run the entire race without stopping. He's seeking training. He reports having what he describes as a mild heart attack. A heart attack is a heart attack, y'all. At 45, completed his cardiac rehab and hasn't had any problems since. So that happened at 45. He's 50. It's been 5 years. He takes some medicines, and that's probably helping him manage those symptoms. During the last visit with his cardiologist, what took place 2 years ago, the cardiologist noted no changes in his medical condition. So, does he exercise regularly? Let's go over to our decision tree. Exercise regularly? Yes. Does he have disease? Yes. Is he asymptomatic though? And it looks like yes, he is asymptomatic. So he doesn't have to have medical clearance to start moderate. But as you progress to vigorous, which he's going to do pretty quickly because he's running a pretty lengthy trail run, he either needs to get medical clearance if he starts to experience symptoms. Okay, because he's gone from walking 40 minutes, which would be moderate, to running a 10-kilometer trail run. He's gonna want to go to vigorous exercise. So as you progress in your training pattern, he's gonna need medical clearance later, but he doesn't need medical clearance to get started. Okay, so let's look at another one. So now we have a 22-year-old, recent college grad, joining a gym as an accountant. So she's sedentary, no longer walks across campus or plays intramural soccer, and has concerns. So she's not currently exercising or getting any physical activity. BMI is slightly above normal, no medical history, no symptoms of disease, and wants to begin playing golf. Okay, so does the person exercise regularly? No. Does she have disease or symptoms of disease? No, so no medical clearance necessary. Okay, last one. 45-year-old collegiate swimmer turned lifelong triathlete requests assistance with run training. His only significant medical history is a series of overuse injuries to his shoulders and Achilles. In recent weeks, he's noted his workouts are unusually difficult and reports feeling constriction in his chest with exertion, something he attributes to deficiencies in core strength. Okay, so basically he just said he has chest pain. He's going to try to give you an excuse like, I think it's this. I think it's just problems with my strength, or it's just muscular weakness. He is not a doctor. He doesn't get to diagnose himself. So what you've heard is he has chest pain, which is a symptom of disease. So I want to make that clear. Don't downplay it because your client doesn't think it's a big deal. They don't get to make that decision. You don't get to make that decision. So make sure you use this as, you would list that as a symptom of disease. His chest constriction is improved with rest, and he often feels dizzy during recovery. So there's another symptom of cardiovascular disease, that he feels dizzy. So does he exercise regularly? Yes, he's been running. Does he have symptoms of disease? Yes. Is he asymptomatic? No. Does he have signs or symptoms suggestive of cardiovascular, metabolic, or renal disease? Yes. So he needs to go see a doctor first. Okay, so I hope that the examples were helpful as we walk through the decision tree, and that will help you use this with your clients in the future.